Yes, Chlamydia trachomatis can cause infertility. This sexually transmitted infection, STI, is one of the leading causes of reproductive health issues worldwide, significantly impacting both women and men. Let's break down how it affects fertility. Impact on female infertility. 1. Pelvic inflammatory disease, PID. Chlamydia is a major cause of PID, a serious infection of the female reproductive organs. PID can lead to scarring and blockage of the fallopian tubes, preventing fertilization. Research shows that up to 18% of women who develop symptomatic PID may experience infertility as a result. 2. Tubal infertility. Chronic chlamydial infections can damage the fallopian tubes, either through direct inflammation or scarring. Studies reveal that high levels of chlamydial antibodies in the bloodstream are strongly associated with an increased risk of tubal factor infertility. 3. Repeated infections. Unfortunately, reinfection with chlamydia is common, especially when partners are not treated simultaneously. Each recurrent infection increases the risk of PID and subsequent infertility, underscoring the importance of regular STI screenings. Impact on male infertility. 1. Sperm dysfunction. Chlamydia doesn't only affect women, it also impairs male fertility. The infection has been linked to reduced sperm quality, including motility issues and DNA fragmentation, which hinder the ability of sperm to fertilize an egg. 2. Testicular inflammation, epididymitis. Chlamydia can cause inflammation of the testicles or epididymis, a condition known as epididymitis. This inflammation interferes with sperm production, spermatogenesis, and can lead to long-term fertility problems if untreated. Mechanisms and risk factors. 1. Biological mechanisms. The infection triggers inflammation and immune system responses that damage reproductive tissues, such as the fallopian tubes and testicular structures. Over time, this damage can lead to scarring, obstructions, or dysfunction. 2. Genetic factors. Emerging research suggests that some individuals may have a genetic predisposition that makes them more susceptible to infertility following a chlamydial infection. These genetic factors may influence immune responses and the severity of tissue damage. Prevention and treatment. The good news is that chlamydia is both preventable and treatable. Routine STI screenings, safe sex practices, and timely treatment with antibiotics can significantly reduce the risk of complications. For those at risk of reinfection, treating all sexual partners is critical to prevent recurrence. Conclusion: Chlamydia trachomatis is a leading yet preventable cause of infertility. By causing PID, tubal damage, and sperm dysfunction, this STI can severely impact reproductive health in both sexes. Repeated infections and genetic predispositions further increase the risk. To combat these risks, early detection, effective treatment, and prevention strategies are key to preserving long-term fertility and overall reproductive health.